On this positive note, I, Dr. Vidhi Jain, student of Symbiosis Institute of Health Sciences, pursuing MBA, Hospital and Healthcare Management Program, on behalf of Symbiosis International University, I welcome you to this session of Healthcare Communications. Healthcare communication is the study and practice of communicating promotional health information, such as in public health campaigns, health education between doctor and patient. To know more about the nuances of healthcare communications, we have with us today an erudite personality, Dr. Aparna Hebani, Dean, Faculty of Humanities and Social Sciences, Symbiosis International University. I now request Dr. Aparna Hebani to grace the dais. We welcome you, ma'am. Dr. Hebani holds a PhD in communication from the University of Memphis, USA, and MA in communication from Western Kentucky University, USA. With over 20 years in the communication discipline, having taught in US, Australia, Hong Kong, Malaysia, she has secured highly competitive grants, has an established publication records, and won numerous Dean's Awards for excellence in teaching. I would now request Dr. Hebani to take this session forward.
Good morning, one and all. On behalf of the Faculty of Media, Communication and Design, I extend a warm welcome to you all. May I please request our key speakers for this track to come on stage. May I first request Mr. Kumar Ketkar. Mrs. Sushma Kapoor. Dr. Pradeep Krishnatre. Dr. G.M. Subbarao. Seema Ahuja, and lastly, Dr. Ruchi Dagri, Director of Symbiosis Institute of Media and Communication, Pune, to join us on stage. Due to time constraints, Mr. Ketkar has to push off for another function and has to travel. He's just here for a few minutes with us. I will now felicitate him and he will deliver his address and then we'll move on to the rest of the program. Thank you.
Well, we just heard an enlightening speech from Dr. Swaminathan, and we learnt about the relationship of behavior with health. Of course, that is very important. She also mentioned the mental health questions. How important they are, I think, is now known to the world. The President of America, Donald Trump, has been declared mentally unfit by many of the psychiatrists and psychologists in America to rule. So mental health is also, of course, important. But apart from that mental health and behavioral aspects, I think even the politics of health has become extremely important. Again, to quote the same example from America, the way Obamacare has been replaced or thrown out and being replaced by Trump Care clearly shows that health has a lot to do with politics and policies. Policies means actually effectively politics. So we are, when we talk about health and communication, in the realm of politics and media, because media is also a kind of politics. And what I have observed and noticed is majority of the medical fraternity is either unaware or indifferent to the communication issues or the media issues. Only recently when doctors were attacked, then the media suddenly became important for them, and many of the doctors used to come to me to ask us how media can be tackled to avoid these attacks on doctors. And then came the bill, and then came the political discussion on attacks on doctors. Well, actually, you can say only two professions are attacked like this. One is media itself. We are attacked quite frequently. And the doctors. You can say lawyers are relatively better. Lawyers don't get attacked as much. And there are many other professions also who don't get attacked. So in that respect, in medical profession or concerning medical profession, communication media are definitely extremely important. And while discussing the importance of media in communication for people on health, what we generally see is media, our media, Indian media, and certainly electronic media, has absolutely very poor understanding of the health issues. Electronic media thinks that if they interview for half an hour, some Ayurvedic doctor, some homeopathic doctor, some allopathic doctor, and have that hello medical programs type of issues, then that chapter is over. But generally the rest of the media does not consider health as news or health as a subject for panel discussion. So as a result, and not only that, even the TRPs that are taken by the advertising agencies and commercial agencies report that health issues on television are generally seen by only those who are directly concerned. Otherwise, they are considered as very boring. And so, TRP is low, therefore advertising is low, the commercial support is low, and therefore electronic media, beyond interviews, generally does not cover health issues at all. The same goes for print. In print, only if there is some kind of an epidemic that may have, like chikungunya, or suddenly there is to be some epidemic recently, 3-4 years ago. So many epidemics hit the country, and we thought they are going to kill the whole humanity like plague, and everything came in the media. But again, explaining the situation, why it came, explaining the necessities and general health care are reduced to Sunday columns in whether you should take hot water or cold water, whether you should take lemon juice or orange juice, whether you should take juice at all. Then one doctor will advise that you must drink a lot of water. Then another doctor in another paper or in the same paper would say actually drinking a lot of water is not good. It unnecessarily pressures the bladder. Then somebody says eat vegetarian, that's only healthy stuff to eat. And then some doctor says, no, for proteins you have to eat fish. It is not good to be only vegetarian. So doctors themselves, if you read Sunday columns, you can actually entertain yourself. If you pick up 2 papers and their health advice, you will find that you get all kinds of advice. And then, of course, now yoga has also become politics with Narendra Modi himself championing the cause of yoga. Whereas then, similarly, some people write that actually yoga is not for health. Yoga is for mental health. And so spirituality, meditation, that matters more than the physical exercises. And then you have, suddenly the only program of health that is seen is Mr. Great Ramdev Baba, who performs the yogic exercises on the TV, and there are many followers for that particular so-called medical program. And I am not sure, despite all this, the 125 crore people of whom about 100 crore people have mobile access and about 80 crore people have TV access, I don't know how many people perform yogas. The recent fad or recent good thing is about so-called morning walks. And so much is written about morning walks for health. And so many people nowadays, you see crowds in the morning walking for health. But soon, at least in Pune, I have seen also in Mumbai, all these morning walkers end up after 1 hour in some Udupi restaurant. And whatever, whatever they have actually spent, the calories, they come back in a very short while. And therefore, as an observer of morning walkers, I have found that those morning walkers who try to reduce weight, reduce calories by walking, actually after 3 years they are at the same level of weight and calories. And they are still trying to reduce weight, so something else is wrong. And then of course a lot of discussion is taken on diet. But one thing is not adequately recognized by all people who are alive, healthy or reasonably ill sometimes, is that whatever you do, whatever we do, ultimately we are all mortals. And that mortality which was mentioned by Dr. Swaminathan just now has not been adequately, healthily it has not been recognized. And that's why Dr. Atul Gawande had to write a book called Being Mortal. And in Being Mortal he says that beyond a certain point, according to him, he's a renowned doctor in United States, a health advisor to governments, and he has written so many books on health, and they're all extremely readable books and widely circulated. He's a columnist for New Yorker. He says that some patients at certain illnesses or certain age need to be told that whatever we do, howsoever expensive and the best treatment we give, it is not possible to make you immortal. You are mortal, as I am mortal. The person who is treating you is also mortal. And that recognition has to be there. And unless that recognition is there, you won't be able to lead a happy and healthy life in the remaining days or generally in the days. Nowadays one hears, I think all of us are familiar, almost every person hears at least one case in 3 months to 6 months or 1 year around us, among our friends, neighborhood, relatives, that they are suffering from cancer. And suddenly cancer becomes the major issue, like Siddharth Mukherjee's book showed, Emperor of Maladies, how cancer has become so widespread. But given the data, that research that was talked about by Ms. Swaminathan, that more people in India die of malaria than cancer. But cancer is at once very tragic and glamorous, both. AIDS is not glamorous, but AIDS is talked about. And number of people dying of AIDS is very small. And yet AIDS has a huge funding for research. But the basic illnesses which have killed more people in India and which kill more people in India actually are not covered because they're not either glamorous or they do not get the TRPs. So for media, it has to learn a lot from you. But media itself on its own will not learn. Because most of the journalists are, excepting few, are there in the media because they cannot get job elsewhere. So they are not qualified to be bankers, they are not qualified to be professors, they are not qualified to be lawyers, certainly they are not qualified to be doctors. So what do? They become journalists. And when they become journalists, they think they know everything, because journalists are supposed to be knowing everything. Because they report on everything, they should be knowing everything. And that's what hits their mind so much that you must have heard on TV some journalist asking an extremely silly question to a renowned doctor, to a renowned lawyer, to a renowned retired judge about the profession or about the qualifications that he has and the journalist doesn't have. It is out of decency that the doctors and the lawyers and the judges and the professors and the scientists do not directly humiliate him by telling him that you know nothing of the subject, you keep quiet. That they don't want to do on camera because that will cut their image. And so they continue to promote ignorance in the media. I think time has come for all the professionals, particularly medical professionals, to get in touch with the media persons. It is not necessary that you hold seminars and workshops for teaching journalists how to cover health. I think it is personal interaction. Personal interaction and personal faith is far, far more important. I'll just give you two examples and I'll close. Is that how we come to know about the local Ayurvedic naturopathic aspects of our health through our grandmothers and through old relatives, old neighborhood. They are not published. Nowadays, of course, they are published, but earlier they were not published. The knowledge passed through, the communication was personal communication, word of mouth communication. And that word of mouth communication has far more weight and value than the printed in newspaper. In fact, many people, despite reading in newspapers, despite getting doctor's advice, finally end up with grandmother's pouch of health care. And I think that word of mouth has more reliability. Doctors, still today, we are an anthropologically driven tribal society in India. You know, for majority of the patients, including me, doctors are like mantriks. There is no difference. Mantrik does something else, doctor does something else. But both of them do something which we cannot comprehend. So, when we condemn mantriks, that we are traditional societies and mantrik should not be the person guiding us, but majority of the people look at doctor as a kind of new mantrik with a different kind of dress code. So, that approach towards a medical professional, that he is going to cure you something of some mysterious disease by some mysterious medicine. And therefore, that relationship between patient and doctor is essentially between a villager who goes to mantrik and him. I think time has come for our society to become modern, and our society has not become modern. Our minds have not become modern, and as a result, that lag, while we have the most modern technology, like I said, 1 billion mobile phones, most modern technology, most modern color television sets in majority of the houses, most of the channels, international, global channels, since we are in globalizing world, we have globalized channels, we have highest number of phones, and so technology has made us modern. But that is not the definition of modernity. Modernity does not mean having a PC or having a tab or having all kinds of access to global communication. Modernity is question of society and mind. If mind is traditional in the negative sense, if mind is traditional, if mind is reactionary, if mind is not ready to learn, if mind is not curious, it is not modern. The first definition of modernity is to be curious, to be ready to learn, to ready also to unlearn. And I think that definition of modernity has not been told. So many of the people here, we talk about Zat Panchayats, we talk about how caste rights take place, that is because of our societies are backward. It is not our societies that are backward. Our societies are backward because our minds have become or remained backward. And unfortunately, with the new kinds of media like social apps, all the social media, WhatsApp and Facebooks and Twitters, they promote ignorance. Nobody thought in the past that ignorance can be promoted, misinformation can be promoted, disinformation can be promoted. Today we are living in a world where we are forced to confront ignorance on a daily basis, on a minute-to-minute basis on our mobile phones, and nobody knows how to fight. There is no censorship, there is no correction. One so-called item comes and that is circulated widely, and we either believe it or not believe it, but it is communicated. That is not the kind of communication we should have or we should trust. It is the duty of all those who are socially concerned. It is the duty of all communicators. It is the duty of all the medical professionals that they communicate through reliable means, word of mouth, using the social media for absolutely the right kind of results. I think all of you will recognize that. Unfortunately, I have to leave to the airport. Therefore, I will not be able to participate in the rest of the session. So forgive me. Thank you. Bye.
Thank you so much, Mr. Ketkar. I mean, this was, he kindly, thank you so much for your gracious presence. He did not have time and he just spared this sort of time for us, so we're really grateful to him. Before we start the next, the remaining part of the session, I would request you to give a huge round of applause to Mr. Ketkar before. Thank you very much. You set the tone of the session, so.
Okay.
I would like to now invite Ms. Sushma Kapoor, the Vice President of Global Health Strategies, to deliver her address. Dr. Hebani, if you would please give a small introduction to Ms. Kapoor. You have a mic here, you can use it. Thank you.
I think Dr. Soumya gave a good segue into our track on health communication by stating the importance of communication in the delivery and in the research within the healthcare sector, and the importance of socio-behavioral aspects within communication to improve the status of communication within India. And I think Ms. Sushma Kapoor is the perfect person to talk more about from a policy level, that too from a national level, on how the country operates and what are the various communication campaigns and policies that her institution handles.
Thank you, Dr. Hebani. Thank you for inviting me to be part of this very important international conference on healthcare in a globalizing world. Thank you, Dr. Vidya. Thank you, Dr. Rajiv. It is a privilege to be here today. So I'm going to focus on the role of advocacy in public health. Advocacy is a key component in driving progress in public health. But the question arises, what is advocacy? Most of us have a general understanding of what advocacy is. It is a tool, it is a means to achieve a goal. If I was to give a simple definition, it would be activities that target stakeholders and decision makers to influence policy, programs, or resources. But then again, you can ask me, what does that really mean? Targeting stakeholders to influence policy, what does that mean? Well, what it actually means is that through advocacy, we can catalyze change to achieve greater impact. Advocacy can create a shift in public opinion. It can mobilize resources to fund an initiative or program. It can champion human rights, healthcare, social justice, and many other causes. Advocacy can open people's eyes and minds to new ideas. It can raise awareness about neglected issues. It can educate them, inform them, inspire them, and bring about change. So it is a powerful tool to drive change, but when it comes to driving change and progress for public health, most of us often think first of scientific research and medical advances. We think about new diagnostics, treatments, medicines, etc. No doubt, all of these are critical to progress, but all too often in today's globalizing world, these advances do not reach the poorest and the most marginalized. Too often, healthcare is not accessible, it is not available or affordable to those who need it most. And this is where advocacy can play a crucial role, especially in the field of public health. It can bring about the kind of change that will help all people to lead healthier and more productive lives. So advocacy is not only important for progress, it is integral to progress. We may not always be aware of it, about advocacy, but we have witnessed it time and again. We've witnessed the power of advocacy to influence policy and raise awareness for public health. So let me give a couple of examples. First of all, example of polio. The polio program in India was a complex and integrated program that included, of course, not just surveillance, procurement, and research, but also large-scale campaign type of operations and a mass media involvement, in short, advocacy at many levels. It involved politicians, doctors, civil society organizations, journalists, and even celebrities who played a critical role in the campaign for a polio-free India. They advocated for greater resources, they advocated for awareness, community participation, and that last mile vaccine delivery. We all remember the iconic face of Amitabh Bachchan. That has been the face of the polio mass media campaign for over a decade. The messaging reached out to people through posters, through TV, through radio spots. And what did it do? It helped to dispel unfounded myths and rumors. It assuaged people's fears, and it encouraged them to take responsibility to wipe out polio. It required a massive coordinated effort to advocate for a polio-free India, and today we know that we have eradicated polio from the country. So the polio example not just highlights the power of advocacy, it also highlights the need for advocacy. In a country such as ours, where more than 1 in 5 people live below the poverty line, there is an urgent need to improve access to and quality of public health care, and to eliminate the great disparities that exist in the society in terms of health care and accessibility to health care. So advocacy can play a vital role in translating public health research into policy. It can elevate the public discourse on critical health issues, and it can bring about a change in public opinion. It gives, most importantly, advocacy gives voice to the poor and the marginalized, and it carries that voice, of course, amplified by the media, by the masses, and prominent public figures, to the ears of politicians, policymakers, parliamentarians, who can then put in place the measures needed to drive change. But before I go any further, talking about advocacy, I first want to emphasize an important distinction. We must understand that there is a distinct difference between advocacy and lobbying. Although some people use the words interchangeably, they are not the same thing. Advocacy and lobbying are not the same things. Lobbying is an attempt to influence specific legislation, whereas advocacy aims to drive change through education, information, and awareness. Lobbyists mostly seek to amend or introduce a piece of legislation that may favor a specific product that they are endorsing. Or it might favor an individual or a group of individuals. But advocates strive to highlight an issue that needs to be urgently addressed and to elevate the voices of the marginalized. Let me give you another example. We have rampant TB, tuberculosis in this country. And what we were doing till about 7, 8 years back, we were using the serology test for tuberculosis. Now, serology tests are blood tests that look for antibodies in the blood. And these tests were being widely used to diagnose TB, but serology tests cannot diagnose the TB bacteria. And their misuse was producing many false tests and leading to a delay in diagnosis and treatment of the individual. This, in turn, was fueling the spread of the disease in India. And as we know, TB kills 500,000 people every year. And a TB diagnostic tool that doesn't do its intended job was something of serious concern. So in 2012, TB serologist tests were banned in India. But how did that happen? The answer is advocacy. Through continued advocacy, concerned parties, many stakeholders, including my own organization, Global Health Strategies, who joined hands with other stakeholders, were able to raise awareness on the issue, were able to sensitize policymakers, media, and other stakeholders. We used evidence, something that Dr. Soumya talked about this morning. We used evidence to generate momentum for the cause. And as a result of this advocacy, members of parliament reached out to the Prime Minister's office, this is 7 to 8 years back, requesting a ban on TB serology tests. And guess what? They were successful. Following this, the government declared TB a notified disease. So it wasn't just one impact, but it was a sort of a roll-on impact as well, that it became, tuberculosis became a notified disease. This meant that all private healthcare providers, caregivers, and clinics treating a TB patient today must report each case to the local authorities every month. Again, something that Dr. Soumya referred to this morning, how we don't have enough documentation. So this is now what is happening with TB. And this has helped to monitor, to record, and manage TB cases in the private sector, which treats over 50% of all TB patients in the country. So this is an example of how strategic advocacy can inform and sensitize stakeholders. This is opposed to lobbying for specific legislation, as I talked about earlier. And this kind of advocacy helps to drive policy change, and it brought about a larger public health good than was initially intended. But engaging stakeholders, especially high-level politicians and policymakers and parliamentarians, can be a very daunting task. How do you get their attention when they have so many other issues to focus on? How do you convince people of the need to address a particular issue, especially people who are not easily swayed? How do you then go on to ensure sustained engagement on such issues so that real and meaningful change can happen? Essentially, how do we build a successful advocacy program to educate and sensitize key stakeholders and decision makers? Now, there are two critical elements that I want to highlight. One is evidence, and the other is capacity building. Let me begin with evidence. It is very important to understand that the starting point for all successful advocacy activities is evidence. Good advocacy will involve a call to action for change, and any such call to action must be rigorously supported by data and information. If a situation demands change, we must have the data to back it up. If we want to speak of public health challenges that demand politicians' attention, we must have the numbers to prove this. And if we want to call for policy change or new program design or greater resources, we must provide information to showcase the impact that this might have. And that can only happen when you present the evidence. Now, this information can come from scientific research, it can come from your economic evidence, it can come from development data, case studies, technical or clinical expertise, or policy and program evaluations. But what we need is a wide range of credible resources, all reinforcing a particular message or call to action, and that can have a powerful impact at the end of it all. Capacity building.